It's time for our nursing tip of the week, and in this week's tip, I'm going to be talking about when we should be calling the provider about something. It can be pretty intimidating at first knowing when to call a provider versus not call a provider, and it can be a bit overwhelming, so I want to cover some of the basic reasons why you may need to notify a provider, and of course, this is not going to be a complete list of everything, but this should be a good start for you. First and foremost, I do want to throw this in here at the beginning that no matter how good of a nurse you are, you can be the best nurse calling about the most obvious reason that you need to call about a patient, and providers sometimes can still not be receptive to it. They may hang up, they may yell, they may not be, reachable. And while none of those things are okay, I don't want to discourage you from calling about something that truly needs to be called about just because you're worried about the provider's behavior. That's a behavioral issue on the provider, not an issue with you calling. With that being said, here are some good reasons you may need to call a provider. This is in my new nurse crash course, but I think it gives you a great starting point for things you may need to call about. So, anytime a patient's having an airway, breathing, circulation issue, unstable vital signs, or changes in vitals that are not expected for the patient and that we may need to intervene on. Arrhythmias, blood sugar changes, could be low, could be high, chest pain, stroke-like symptoms, any sort of critical labs, and not just critical labs. Sometimes you need to call about labs that are abnormal for that patient that we may need to do something about. For example, maybe a hemoglobin's low, maybe that there's been a drop in platelets, etc. Any abnormal bleeding, loss of loss of pulse extremity. Why does that sound so weird? Safety concerns, you may call provider about that, but not as much so. And then definitely change in LOC. Most of the time when we're calling a provider, it's because we are anticipating some sort of action from them or order from them or something that we may need. Now, there are times you just call to notify because you're required to, and there are going to be lots of times that you're calling because you're like, hey, I need an electrolyte replacement, I need fluids, I need blood pressure medication. So always anticipate what you are potentially needing from the provider when you are calling. Also, look through your order sets at the beginning of your shift on each of your patients to see if there's any standing orders or reasons why you may need to notify the provider. Maybe it says notify if urine output's less than 0.5 mils per kg per hour. Maybe it says notify if patient is having increased oxygenation needs, etc. Remember, when in doubt, it's always better to call than not to call, and always document that you notified the provider of whatever you notified them of, as well as the outcome or results from that conversation. And that is your nursing tip of the week.